Now, if you want to talk about looking younger, erasing some of those lines and wrinkles and building collagen, topical skin treatments can only go so far. And if you're not ready to go under the knife or needles, many of Hollywood's elite swear by Sofwave. It's ultrasound technology that heats deeper layers in the skin to help produce collagen and elastin. Dr. Carolyn Jacob explains what it is and how it works.
Sofwave is parallel beam ultrasound technology. So it's not a laser, it's ultrasound. And ultrasound can create heat, and heat remodels collagen. So how it works is it actually puts that heat in the middle portion of the skin, which is where we have the densest amount of collagen in the first place. So it renews the collagen that we have, gives you more denser collagen, and therefore a lift.
Okay, this is going to sound funny, but I'm just trying to use a comparison. So when I had my children and I got ultrasounds, what's the difference?
It's about how the ultrasound power is delivered.
Got it.
So it's a higher power. There's like 7 little transducers. Instead of going down to see inside, it goes across. But in the way they have it specified, it creates heat.
Okay, and then that heat, you're basically causing damage and forcing your body to repair itself, right?
Exactly, and they've seen this in histology, which is our big word for taking biopsies and looking at the skin, that there's denser collagen exactly where those little transducers made the line of collagen. So you're getting a very large area of collagen replenishment in a very small area of treatment time.
When you compare this to, say, lasers and other treatment, like microneedling, things like that, what's the difference in the way it works?
Excellent question, because we do all of those things in our office as well. And so I'm constantly explaining to patients that the microneedling and the lasers are more for the surface layer of skin, which is fabulous and serves its own needs. This is more for the middle layer of skin where all that dense collagen needs to be, and we lose that collagen as we get older. So it's kind of making the thicker part of the skin more youthful and even more thick, if you will.
How long does it take to actually see improvements?
Yeah, so it's interesting. You get gradual improvements. Some people say they see differences off the table. I always say that's probably just the heat. But normally it's about 3 to 5 months. A newer publication that they just came out with showed that there was continued collagen replenishment even beyond 4 months.
Oh, wow.
So that was kind of really nice to learn about.
And then if you're doing like a microneedling or a laser, because the surface is probably, you see more soon, more quickly, but less.
It's complementary, and some of those treatments, such as a laser, might be like a laser peel. You're going to see differences in the color of the skin, but not necessarily that dense thickness that we need in the collagen. So I say they're complementary. I can do them on the same day in my office.
Oh, great.
For some patients, we'll do the Sofwave first, and then we'll do the more topical treatments afterwards.
How often should you get Sofwave then? Because it sounds like if the more you're building it, the better off you're going to see, right?
Every month.
Right.
So we tell our patients about every 4 months is what we're aiming for if they have more damage. So if they're younger, they probably can do 1 every year. And just try to keep up with it, because of course your skin is an organ, it's constantly breaking down. We're trying to build it up. So giving it that little jump start several times a year. If you're over 40, I tell people get it done twice a year, every 6 months. So it kind of depends on the age and the status of their skin.
And could you year over year see improvements in your skin then?
Absolutely. I mean, they've shown, the Sofwave's been out for several years now, but they've also shown continued improvement with more treatments. So some of their studies, they actually did multiple treatments in them. So can you take someone who's 80 and make them look 40? That's a whole host of other issues that come into play besides just the skin.
Right.
But if you're talking about skin rejuvenation, I mean, this is a home run for patients.
And is this something you can do anywhere?
You can. They actually did the studies on the arms, so for helping out with the crepiness of the arms in this bat wing area. The thighs, it's a beautiful treatment for reduction of cellulite appearance of the thighs, and it also works for acne scars too.